Good afternoon, everyone. Happy to be here with Chief Medical Officer of Health, Dr. Dina Hinshaw, for our daily COVID update. Just wanted to briefly follow up on yesterday's exciting announcement about Alberta's Open for Summer plan. It is a safe and cautious plan to gradually reopen Alberta, get back to normal, based in part on a measurable decline in COVID-related hospitalization numbers and, of course, the growing protective effect of vaccines. This is Alberta's response to the science of vaccines, of population protection, because at the end of the day, we cannot permanently rely on damaging public health restrictions to protect our public health from this pandemic, especially since we now have the incredibly powerful and effective tool of vaccines that have been in jurisdictions where there has been widespread use of vaccines and other forms of protection, like from natural immunity. We have seen those jurisdictions be able to open up, get life back to normal, while continue to observe significant declines in pressure from COVID, including new cases and hospitalizations. I'm pleased to see today that we continue to see a decline in our COVID numbers, as Dr. Hinshaw will report, and in our hospitalizations. As you know, one of our central concerns throughout has been the particular pressure on intensive care units, and we've now seen very clearly that about 10 to 14 days ago we reached our peak at about 188 ICU admissions. That's now down to 150 over just over a week and a half. So a very encouraging sign of a pressure abating. Once again, a great word of gratitude to all of the frontline health care professionals who've been working under great stress for months now, in the hospitals generally, but also in intensive care. And finally, once again, a renewed call to Albertans to sign up and help us to crush COVID with the vaccine. That's the way that everyone can do their part. I know I've been hearing from some people a concern that we are supposedly coercing people into getting the vaccines by tying the rate of population protection to our prudent plan to open for summer. But the truth is that getting a vaccine is a voluntary decision that individuals must make, and that's why Alberta is actually, the Alberta legislature is set to pass an amendment to the Public Health Act to remove the mandatory power of government to coerce people to take the vaccine. That's been a power found in the Alberta law since, we believe, 1910. So just to underscore that this is a free choice, we are repealing that power because we had no intention of using it, and nor do we have any intention of using vaccine passports. But none of that changes the fundamental fact that the most powerful way that you can protect yourself, your family, your loved ones, friends, and neighbors, and the most powerful thing that you can do to help protect our broader society and accelerate our return to normal is to get the safe vaccine. We have administered over 2.5 million doses to over 2.5 million Albertans. Of course, there's about 9% who have received a second dose. But 2.5 million doses, 2.2 million Albertans who have received at least a first dose. And we have closely tracked 385 adverse outcomes from those 2.5 million doses. You can do the math yourself, but it's clear that these vaccines are 99.99% safe. In fact, of those 385 adverse events, the vast majority have resulted in minor symptoms like nausea. We have experienced one confirmed fatality out of 2.5 million doses administered, as compared to nearly 2,200 deaths from COVID. So there is simply, and I know that at the beginning of the global vaccine program, there was perhaps understandably a degree of caution and skepticism amongst many people, including some Albertans. I understand that. But we now can look at enormous world experience. We're talking about hundreds of millions of doses that have been administered around the world, entire populations that have received high levels of protection. Countries that were 5, even 6 months ahead of us on the track to vaccination, like, for example, Israel. And we can observe there, as scientists have, as medical experts have, the safety of these vaccines and their effectiveness. So we should say yes to the science of vaccines. That's a large part of what Alberta's safe, open for summer plan is built around. I'm pleased to report that we have 556,000 bookings right now over the next 28 days, and 433,000 of which are over the next 2 weeks. And that, if those folks show up, just those 433,000, we will increase by about 12% of our eligible population, the percentage of Albertans who are vaccinated. That means we'll reach the 70% threshold. But those folks need to show up, and we need to keep driving for ever higher numbers, for broader protection, and that also will allow us to begin transitioning back more quickly to protective second doses. So we are, at the very beginning of this, we said pretty much every day that we're all in this together. I think we kind of gave up on that because it started to sound a bit cliche, but the truth is we truly are all in this together. Sometimes I've heard people in the COVID debate. I did a Facebook Live session last night, and some people were saying that they're not getting vaccinated because they're young and healthy and they aren't concerned about being affected by COVID. I would respectfully submit to them that they're missing the point, because as long as they're not vaccinated, they stand a chance of becoming infected and then potentially of infecting others. We are truly, in a scientific, in an epidemiological, and in a social sense, we are truly all in this together. So if you care for your neighbors, if you want to show a sense of compassion for others, especially the most vulnerable, the most compassionate thing you can do right now is to go and get signed up, follow the science, and help us get back to normal, regain our freedoms as quickly as possible. And with that, I'll invite Dr. Hinshaw with her daily update.
Thank you, Premier, and good afternoon, everyone. Before I provide the update today, I want to note a change we are making to eligibility for early second doses for those who are at risk of not having a protective response after their first dose. There is evidence that those on regular dialysis for treatment of kidney disease have lower responses to vaccine, so we will be adding this group to the list of those who can call HealthLink to receive a second dose of vaccine 21 to 28 days after their first. To be clear, this is a small group of those who are profoundly immune compromised and for whom having that second dose earlier is crucial. I expect to have more information as early as next week about the timing of second doses for all other Albertans. Moving on to the update. Over the last 24 hours, we have identified 513 new cases of COVID-19 and completed about 9,000 tests. Our positivity rate currently stands at 6.1%. Like cases, hospitalizations continue to decline, which is promising. There are now 538 people in hospital being treated for COVID-19, including 150 in the ICU. Sadly, I must announce that one new death was reported to Alberta Health in the last 24 hours. While it is good to see a decrease in the number of daily deaths, each death is yet another reminder that while we are rolling out the vaccine and looking forward to brighter days ahead, this virus is not yet tamed. I want to extend my sympathies to the family and friends of this Albertan and to anyone else who has lost a loved one to any cause. Providing protection to as many Albertans as possible through immunization is the way we can collectively prevent more tragic losses like this one. Yesterday, Premier Kenney announced Alberta's Open for Summer plan for easing restrictions based on vaccine uptake and hospitalizations. As you know, I was not at the media avail yesterday, as I had promised my children I would spend the day with them while they were on a PD day. This day was booked off long in advance. Today, I want to spend a bit of time sharing my perspectives on Alberta's Open for Summer plan. My team and I were fully engaged in the development of this plan. We looked closely at the evidence seen in other countries, including Hungary, Israel, the UK, and several US states, as well as other Canadian provinces that had announced their opening plans. I believe this plan is a prudent approach to reopening, with Stage 1 prioritizing the easing of low-risk outdoor activities and only proceeding to the next stage as thresholds are met and the 2-week window ends. This stage is much more cautious than what you see in our neighbouring provinces, BC and Saskatchewan, in their easing of stage 1 because we have recently had higher cases. We also considered the fact that the public health measures that have been needed over the past year are unprecedented in our lived experience and that they come with significant public health impacts as well. We have used these measures to save lives and protect the healthcare system from being overwhelmed, but these interventions have never been taken lightly. It is my opinion that we need to be as mindful of recovering from the impacts that the last year has had on Albertans' mental health, well-being, and determinants of health, as we are of the direct impacts of COVID-19 infection. All of these considerations helped inform our team's recommendations to Cabinet. For example, it was our recommendation that the plan focus on the percentage of all Albertans 12 and over who have the vaccine, instead of just the percentage of adults with a first dose, as some other jurisdictions have done. Based on best available science, we recommended the threshold of 70% with at least 1 dose in this age group as the metric for the removal of most mandatory public health restrictions. This maximizes the protection that we will have before significant reopening takes place. It is important to remember that the 70% trigger is a public target that protects Albertans and is a goal that we can all help to achieve. Every Albertan can rally together to achieve this level. However, Alberta's plan has many other factors that underpin it. This includes overall community protection, including post-infection immunity, second dose vaccine uptake, and vaccine effectiveness. It also includes monitoring the spread of the virus in the province and our health system capacity. All of these are essential parts of safely reopening and keeping cases down so we can stay open for good. And they are all accounted for in Alberta's Open for Summer plan. My team will keep closely monitoring case levels and hospitalizations, including ICU admissions. If we start to see cases rising over an extended period of time, with impacts flowing into severe outcomes, the plan allows for any needed adjustments. I know that some Albertans are wondering why second doses are not specifically mentioned in the plan. We focused on first doses because that is the most immediate target that we need to reach. But let me be clear, second doses are essential and are an integral part of the plan. For this plan to work, we need as many Albertans as possible to get a first dose and then get a second as soon as they are eligible to do so. We are looking closely at our available supplies and shipments, and we expect to be in a position soon to shorten the wait time between first and second doses. We will outline how this rollout will occur as early as next week. In the coming months, we will be closely monitoring second dose uptake. It is essential that all of us get our second dose when the time for that comes. Second doses are critical to keeping transmission low in the months ahead. Finally, I want to address the process around the Open for Summer plan. While policy decisions are the government's decisions to make, I support this plan, and it was developed with the expertise of medical professionals and civil servants in the Department of Health. The plan that was approved and released yesterday is solidly based on the original draft we submitted for consideration, with some adjustments that I had input into as decision makers considered approving the plan. I believe that this plan will work for Alberta, but it will take all of us. Just like it seemed it was not going to be possible for businesses to reopen and for the Calgary Stampede to take place following the 2015 floods, a massive collective effort accomplished the difficult task of making this happen. The same thing can, and I believe will, happen now, not just for the Calgary Stampede or for K-Days, but for the many other activities and events that we all want to see happen this summer. On surveys I've seen asking what people are most looking forward to after the restrictions are lifted, most people talk about simple things, like gathering with friends and family to have a meal, or celebrating a milestone together. Instead of physical movement of mud and debris, this time we can succeed as long as Albertans heed the call to be vaccinated in record numbers and keep doing everything possible to stop the spread by following current public health measures. We will also be more successful together if we are respectful of each other, focus on the task at hand, and ask how we can best support each other. If you hear questions about vaccine safety, direct people to reliable sources of information. If you hear questions about why masks are still required, remind those asking of the fact that we still need to protect each other as we work to hit the vaccine coverage targets. Even past the point in time when mandatory COVID measures are lifted, we will still need to support each other in taking the precautions that are needed. For example, those at higher risk of severe outcomes may still want to wear masks or avoid crowded indoor places for a while after mandatory measures are eased. That's okay, and the more that we can be compassionate with each other in what we need, the better we will be able to navigate the challenges that the post-restriction period will bring. We have now administered more than 2.5 million doses of vaccine. In the coming weeks, we will be doing everything we can to make sure that all Albertans who are eligible have every opportunity to receive the vaccine. Appointments are available in every region and community. If your appointment for a first dose is still weeks away, there probably is one much sooner. Try searching for an earlier appointment at a pharmacy or Alberta Health Services location near you. They may have a spot available as early as tomorrow. Just please be sure to cancel your old appointment if you do find a new one. As announced earlier today, we are also looking at new ways to help reach Albertans in areas where vaccine uptake is lower. AHS will be launching a drive-through clinic in Calgary's northeast next week to help get more people protected. We are also looking at temporary clinics or other tools to help increase uptake in other areas of the province as well. We are at a crucial point in the pandemic, a point where each of our actions have the potential to bring us one step closer to a post-pandemic life. I urge all Albertans to seize the opportunity in front of us. That means getting vaccinated. It also means being part of the solution by continuing to closely follow the rules as long as they are in effect. To the vast majority of Albertans who have done the right thing from the beginning, thank you for sticking it out a little while longer. You have helped us get to this point. To those who may not have closely followed the rules so far, it's not too late. You can still do your part and make a difference. From the beginning of our pandemic response, I have said we are all in this together, as the Premier just said. While the past 15 months have challenged us and at times divided us, this fact remains more important than ever. Every choice we make, together, is another opportunity to get us closer to the end of the pandemic. Thank you, and we're happy to take questions.
Great. Thank you, Dr. Hinshaw. Just a reminder to our journalists on the line here to please keep your questions brief so we can get to as many as possible. And a reminder as well that you will have one question and one follow-up. And with that, operator, can you please put through our first caller?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw. There are only 2 weeks between when a benchmark is reached and when the next stage comes into effect. Now, we've heard in the past that it normally takes 2 weeks to see what impacts changes to restrictions make. So how does a 2-week gap between stages make sense from a medical and scientific perspective?
We wanted to make sure that between hitting one trigger and then moving to that particular opening stage, there was a full 2 weeks so that people were achieving a level of protection. We know that when people first receive their immunization, they don't have a significant level of protection in the few days following that. We know that we start to see a difference in the protection that vaccine offers at that 2-week mark. And so it was important to make sure that when we hit those metrics, we weren't moving immediately to opening up our measures or increasing activity levels, but we were waiting for that immune response to mature and to be able to have the full impact. It's also important to remember that when we hit a particular target of a certain percentage of Albertans 12 and over being immunized, many of the people in that group would have received vaccines in the days and weeks prior to that. So hitting that target and waiting the 2 weeks, again, gives that maximal opportunity for protection to come into effect and to therefore, again, allow these levels of protection to increase as we slowly ease the public health measures.
And do you have a follow-up at all, Julia?
Yes, I do. Thank you. This will be for Dr. Hinshaw and the Premier. Dr. Hinshaw, you mentioned that we'll hear more about second doses next week, but AHS says that there are 100,000 available vaccine appointments over the next 15 days. So if appointments are available right now, why not use them for second doses?
It's important to know that the available appointments that they're talking about, most of those aren't, today, tomorrow, and over the weekend. The majority of available appointments really start opening up towards mid to late next week. And so again, we're looking at that. We want to make sure that all Albertans who are eligible for their first dose have that opportunity to sign up as soon as they're able to in a location that's convenient for them. And that availability that you mentioned is the reason that we're considering that second dose beginning. But again, given when those appointments start opening up towards the middle to later part of next week is, again, part of the timing of considering the announcement and wanting to make sure that we do provide that full opportunity for those who have not yet gotten their first dose or who may be booked for a first dose, say 3 weeks down the road, but may want to find an earlier appointment. Now is the opportunity to do that. And again, we should have information about second doses by next week.
And I would only add to that comment that Alberta, fortunately, is further ahead, is much ahead of the other provinces with respect to second dose administration. We have twice as large a percentage of our population who have received the second doses versus the national average across Canada. So we've got a bit of a head start, which is good news, as we will begin moving into the broader administration of second doses per the announcement that you can expect next week.
Thanks very much. Operator, can you please put through our next caller?
Next is Jeff Slack with 660 News. Go ahead, Jeff.
Thank you for taking my question. This one's for Dr. Hinshaw. This Open for Summer plan is largely based on people at least getting one dose of the vaccine. Even if we get to that 70% population of coverage, is there still a risk that people can end up in the hospital?
One of the things that I've been talking about with my colleagues across the country is the challenge that we will collectively have as we transition into the next part of the pandemic. COVID-19 is not going to be eliminated. And just like we have influenza season every year, like we have other risks of every activity that we undertake, there will continue to be some risks from COVID-19. But what is really important is that we are balancing the risks of the extraordinary measures that are in place with the risks of COVID-19. And so as we are encouraging all Albertans to take the opportunity of being vaccinated to protect themselves and others, we again want to make sure that that level of community protection is high enough to mitigate the possibility that waves of transmission could severely impact the healthcare system or could result in surges of people who are unfortunately dying. And I believe, based on looking at global comparators, looking at the effectiveness of the vaccine, and looking at not just that proportion of 70% plus with at least one dose, but based on incoming vaccine supply, again, I believe as we're hitting those targets that we will be able to also increase that second dose protection by that time. I believe those metrics help us to achieve the goal of no longer risking overwhelming our healthcare system and protecting the majority of Albertans. And then at that point, just like we all need to navigate risks in our lives, individuals will need to navigate those risks based on their own individual profile and the protective measures that they need to put in place. And of course, over the summer months as we're transitioning, even though the mandatory measures will be lifted, it will be important for all of us to consider how we can continue protecting each other, staying home when we're sick. Those kinds of basic things will continue to be important. But again, that level of risk will move into something that is more navigated at an individual level and no longer requires the extraordinary measures that we have had to put in place over the last year.
And did you have a follow-up at all, Jeff?
Yes, I do. Thank you. Just following that, are you worried or is it possible that if we hold the stampede, with thousands of people gathering there, that we could see another surge of people needing hospital treatment then?
What we know looking at other jurisdictions that have achieved high levels of community protection, and again, looking at some U.S. states, looking at Israel, looking at the UK, where they've started allowing some larger events to happen, there could potentially be some transmission that may happen. Again, it would be really important, as we've been working with the Stampede and other large event organizers, to ensure that there are safety plans to mitigate the potential for those kinds of super spreading events. But part of that, again, is the level of protection, and as long as we reach that collective level of protection, it will be transitioning over the summer into supporting and allowing people to be able to navigate their individual risks as they would any other risk. And so I don't believe that the Calgary Stampede, if we achieve the target that we're proposing, will be a significant risk to our healthcare system. And I just want to underline the point that when we look at neighbouring provinces' plans, so BC and Saskatchewan, and their stage 3 events that they're allowing, both of those provinces have focused on a 70% uptake in those who are 18 and older, and still are allowing very similar types of events to happen over the summer. Whereas in Alberta, we are, again, if we reach this target, and I believe we have every reason and possibility of doing so, we'll have an even higher level of protection before we move into those types of activities.
Just to underscore that, because as Dr. Hinshaw said before, where our neighbouring provinces are basing their thresholds on adult population 18 plus, we're doing so on those over the age of 12. So we're actually, our plan is more cautious in terms of achieving population protection for opening.
Thank you. Operator, can you please put through our next caller?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Doctor and Premier. This is a question for the Premier, and I will have a follow-up. What do you say to, I'm sure you've looked at a lot of the reaction today, pro and con. What do you say to those people who keep insisting, no matter what you say, no matter what Dr. Hinshaw says, no matter what other people say, keep insisting that this plan is horrible, reckless, and will lead to all sorts of very horrific, a very horrific future, that just keep insisting on that, no matter what you say? I mean, what can you say to sort of pierce through that particular point of view?
Well, I guess I would put the onus on people with that critique. If 70% population protection is not adequate, then what is? Perhaps some of that is coming from the advocates of so-called COVID zero, who are willing to inflict endless damage on our broader social health in order to completely eliminate risk. But eliminating risk with a disease like this is effectively impossible. The Spanish flu continued to circulate as a virus until the 1950s. And at some point, as Dr. Hinshaw has just said, we have to personalize the risk rather than socialize it in a way that costs our entire society enormously. The point is this, that as the World Health Organization said from the beginning, lockdown policies should not be the primary public health response. They should only be used because of the damaging their collateral damage. I'm paraphrasing the WHO, but they should only be used to flatten the curve, to expand your healthcare capacity, and avoid your hospitals from being overwhelmed. That is exactly how we have used restrictive policies in a targeted way in Alberta. But the notion that we should put our entire society on virtual indefinite hold, inflicting massive collateral damage on people's lives and the exercise of their constitutional protected freedoms is, I don't think, something Albertans would accept. I'll just go one step further on this, Rick. I find it peculiar that as we kind of move to this hopefully last stage of the COVID debate, we see a kind of strange alliance coming together. of those on the two polarities of the debate, the two extremes of the debate, because they're both now questioning or doubting the efficacy of vaccines. We have some vaccine skeptics who that's just their reflective position and are opposed to the government promoting vaccines. And on the other end of the spectrum, with those who support hard lockdowns, they're essentially telling us that vaccines are not actually a way out of this, regardless of the real lived experience in jurisdictions with high levels of population protection. So I would respectfully suggest to those folks that they are undermining public confidence in the protective effect of vaccines. How can we, I would just say to them, how can we urge Albertans who are maybe a little bit hesitant about the vaccines to go and get the jab if we then say, and by the way, we're going to have to continue to impair many of your fundamental rights and freedoms and restrict much of what you do. So it seems to me the strongest and most powerful way to get to population protection, to get past effectively the pandemic, is to maximize the number of people who are going to get the vaccines, and that means connecting it to regaining our freedoms and getting our lives back to normal.
Great. You can go ahead with your follow-up, Rick.
Thank you. Premier, everybody who takes a position on a public issue thinks that they have the support of most people in their jurisdiction. What kind of support do you think you have among Albertans for this particular plan 24 hours after it's been rolled out?
Good question, Rick. So, as you know, we've been doing a lot of public opinion research throughout the pandemic, so we can see, we can understand the public's willingness, for example, to get vaccinated, their tolerance level for restrictions, their compliance with those restrictions, and all of those other things. It's important for us, because we're dealing with the whole of society here in really big ways, to know kind of what people are thinking. So in our most recent public opinion research, just completed on May 22nd, we asked what people thought about this basic framework that we announced yesterday about tying a broad opening and lifting of restrictions to achieving a protection target of 70%. And it was about 75 to 80% support for that. So I think there's broad support for the plan that was announced yesterday.
Right. Operator, can you please put through our next caller?
Next is Janet French with CBC. Go ahead, Janet.
Hi there. My question is for Dr. Hinshaw. Some parents of children under age 12 are concerned about the reopening plan because children can't get vaccinated and they're not immune to COVID. So how does this reopening plan take children's safety into consideration, and what would you say to try and reassure parents?
It's an important question, and certainly having two elementary-age children myself, one that is both personally and professionally of interest to me. What we've seen in other jurisdictions, I'll use Israel as an example, is when they had very high protection, high coverage level for vaccines of those, and at that time in Israel it was those who were, I believe, 16 and older. At that point in time, Pfizer did not have the research yet, as they do now, for the efficacy and safety of the vaccine in those who were 12 and up. And what they saw is with a really high level of coverage in those who were 16 and up, their COVID levels fell dramatically, and they actually saw that their COVID levels in younger children fell as well. We've seen throughout the pandemic that children do not tend to be high transmitters of COVID-19, particularly young kids, and that sort of 10 to 12 tends to be a bit of a cutoff for when children older than that tend to transmit more than adults. Children younger than that tend to not be as likely to get COVID and not as likely to transmit it. Of course, nothing is zero risk, but based on Israel's experience and based on what they've seen, based on what we know about how COVID spreads, place, it seems unlikely that if we achieve the high level of protection that we are targeting, that younger children would remain as an ongoing reservoir for COVID-19, as that's not been what's been seen in other jurisdictions. And I want to emphasize again that the two things that we all need to do, one is, again, the immunizations and making sure that everyone who can is taking advantage of the opportunity to protect themselves and others. And the second thing is really driving down our transmission levels over the next several weeks, which is why the early stages of our reopening plan are more cautious and more limited than our neighbours to either side, because we have had higher cases recently. And as more people really focus on holding on to those limited the restrictions that are currently in place and reducing community transmission, so we can enter into those high levels of protection from vaccine with the lowest possible level of COVID-19, that's also going to protect young kids. And so as long as we're doing both of those things together over the next several weeks as we increase vaccine coverage, I believe that younger kids will receive a level of protection as we've seen happen in Israel.
Do you have a follow at all, Janet?
I do. New topic. A federal panel has recommended that Canada end hotel quarantine for all incoming travelers and end testing and quarantine for fully vaccinated people. Do you support these measures, and why or why not?
It's really important as we continue to monitor the current state, monitor evidence, that we adjust our policies. And as you know, in Alberta just last week, we did shift to no longer requiring post-contact quarantine for people who are fully immunized. I think that as we move to increased levels of protection within our country, and we see that same kind of protection increasing in other places around the world, that we consider the impacts that travel restrictions are having on Canadians, on Albertans, and on people from other countries who may have a variety of reasons for needing to come into our province, or Albertans who need to travel and then come home again. And so the exact timing of when that might happen, I think, is informed by the fact that provinces and territories across the country have different contexts. And so at the federal level, I would assume they need to navigate that. But certainly from an Alberta perspective, as we look at the evidence around vaccines and the efficacy of them after being fully immunized, I think it is absolutely appropriate to be looking at that evidence and then making our policy based on that evidence.
If I could just perhaps add a response to supplement Dr. Hinshaw's in response to Janet's first question. A very good question, because I can understand parents being concerned about their kids who are not eligible for the vaccines at this point. But there has been a lot of research on this question. I would just point you to one study, for example, that was published last September by the Journal of the American Medical Association, which effectively concluded that COVID-19, the risk posed by COVID-19 to children in that age category is roughly similar to the risk posed by the conventional influenza A or B. So the same kind of policy response, it seems to me, is appropriate. That is to say, sometimes the flu can have a negative impact on the health of young children, and that will be true of COVID in the future, but it's a very small risk, and I do hope that at some point the expansion of these trials will will validate the use of the vaccine for younger kids, as is the case for the conventional flu vaccines.
Okay, we have time for about 3 more callers today. Operator, can you please put through the next call?
Next is Camilla DiGiuseppe with CTV. Go ahead, Camilla.
Thank you very much. This first question is for the Premier. Hi there. Last night you suggested that there was very little sense of giving people vaccines unless we opened up business as usual. However, most medical professionals say one vaccination does not get us to a safe place, and that 2 vaccinations make for a much safer opening or transition. To suggest that people who do not support your plan do not believe in vaccinations is untrue, and some would agree that despite your calls not to politicize this issue, it appears that is what you are doing. So why do you choose this approach?
I must confess, I find that a little confused by your question, and I'm not sure what you're ascribing, what statement you're ascribing to me last night. The basic point I'm making is this, that the more quickly we get population protection driven by vaccines, the more quickly we can safely lift public health restrictions and basically replace restrictions with vaccines as the primary tool to prevent viral spread. And this is not a novel idea. It is, I would think, what every jurisdiction around the world is aiming for. It's what a number of jurisdictions have successfully achieved. So I don't think it's really debatable to suggest that vaccines are our ticket to getting past the pandemic and getting our normal lives back. Of course, we have to do that in a careful and prudent way. That is what we are trying to do with Alberta's Open for Summer plan. In speaking about those who I just characterized in response to Rick Bell, I think kind of two extreme positions I see in the debate, which people have a right to articulate in a free society for sure. One is a hardcore opposition to vaccines, which for some people seems to be kind of a deeply set belief, and they in part believe the vaccines are not effective. I was responding to one caller last night who said that, questioner on Facebook Live, who said that, in fact, the hospitals are filled with people who have received vaccine shots. And my response was that I believe the Public Health Agency of Canada has tabulated data, and Dr. Hinshaw might know the exact number better than me. My recollection was that out of about 22 million doses administered in Canada, they've identified about 6,800 that led to people who had been vaccinated who were subsequently infected. And my point was that is evidence of, like I said, it's not impossible for somebody who's been vaccinated to get infected and ultimately to be hospitalized, but the chances of it are extremely low. So that's sort of one extreme of the debate, and I would say the other extreme is to say that we can't have confidence in the protectiveness of the vaccines and therefore have to maintain enormous impairment of people's fundamental rights and their normal lives. I think the prudent middle ground approach is to take yes for an answer when it comes to the scientifically proven protective effect of vaccines.
And do you have a follow-up at all, Camilla?
Clarified, it was from last night's Facebook town hall. So my second question also for you, Premier, is today you called the NDP the party of anti-vaxxers. Do you stand by that statement, and why?
Well, I just refer exactly back to my last answer. People who are calling for a constant impairment of fundamental freedoms and lockdown policies, even after vaccines have got us to 70% plus population protection, are really putting in doubt the protective effect of the vaccines. The science is clear. The vaccines work. They save lives. They protect our healthcare system. They are the answer to the problem of controlling the virus without using the blunt and sometimes destructive instrument of public health restrictions. So those, I believe, the official opposition in Alberta, who are saying we have to keep Alberta on an indefinite lockdown at least through to September, and that's the position articulated by the Leader of the Opposition on radio this morning. I respectfully disagree with that position, and I respectfully believe that they are understating the protective effect of the vaccines. In fact, instead, I would invite people across the political spectrum to look at the science, look at the real-world results in jurisdictions around the world about the protectiveness of the vaccines, how effective they've been at saving lives and protecting healthcare systems.
Okay, operator, can you please put through our second last caller?
Is Jennifer Lee with CBC. Go ahead, Jennifer.
Hi, thanks for taking my question. This is for Dr. Hinshaw, if I can. There are concerns, that we're hearing from some doctors and scientists that this reopening plan could essentially open the door to a surge in variant cases because the plan hinges on those single dose metrics, those single vaccine dose metrics, and because you've got a variant, the B1617 variant that's causing concerns in the UK now, which is we're hearing here is not as responsive to that first vaccine dose. So I'm wondering what Alberta's plan is in terms of screening all positive, returning to screening all positive cases for variants of concern, including that one in particular, since we did stop doing that, I think it was early May. So will Alberta be resuming that screening? And if not, what is the plan?
As you mentioned, we did shift to screening a targeted sample of our positives in early May, as our case count was extremely high at that point in time. One of the benefits of the decreasing case count is that we have the capacity to screen more of those and a higher percentage. So as we screen about the same amount, the lab has been developing the capacity to do rapid screens for the B1617, which is great news. And we are working with them to determine what the most sustainable way is going forward to be able to identify variants, whether that's screening 100% of all new cases, or again, the targeted surveillance sampling that we have been doing to make sure that we're capturing variant status of any severe cases, any cases that are identified in somebody post-immunization, all outbreaks, with a geographic representation across the province. And again, working with the lab to pinpoint and finalize what that strategy is, but certainly at the current time, we are screening a higher percentage of all of our new cases. And again, the best way that we can ensure that we have that robust sampling and the lab capacity to do it is to continue to drive down our new case numbers. I would also just want to emphasize something that I said earlier about the fact that although the metrics are really focused on that 70% with at least one dose, we do anticipate very soon that we'll be able to make second doses available. And with the supplies that we anticipate coming in over the following weeks, I expect that by early summer, we will be able to offer second doses to the majority of Albertans in order to have not just that first dose, but second dose. But again, the point of having a metric that really is simple, that everyone can understand, and focusing on that first dose metric does not exclude the fact that we will be having increasing volumes of people with the second dose protection as well, as we have sufficient supply to offer that. So I want to make sure that's clear that while we're focused on that 70% of at least one dose, we will have an increasing number of people able to get that second dose as well, with increasing volumes over time.
And Jennifer, do you have a follow-up at all?
I do, thanks. You mentioned there's a higher percentage of those daily positive cases that can be screened for variants of concern. Can you give us a sense of what percentage that is right now? And when will that rapid screening test for B1617 be in place? Do you know?
I'd have to take that away and give you the exact percentages that we've been seeing over the past few days, because that does fluctuate a little bit depending again on how many positive cases we get. So we'll have to get that specific answer for you. And again, I'm not sure about the exact timeline of the screening test for the B1617, but certainly within, if it's not already in place, I expect that it would be within the next week. And again, we can follow up and get back to you with that specific timeline.
And if I could just add just a little statistical context to Dr. Hinshaw's point about our ability to start pivoting towards more second doses soon. We are scheduled to receive 1.4 million additional doses over the next 4 weeks. And over the same period, we have 556,000 bookings as of last night. So right now, we would have a notional surplus of upwards of 600,000 doses. Now, we hope and expect that a lot of those will actually be taken up by first dose bookings, but it does show you that we're now starting to receive a sufficiently large supply of new doses to be able to walk and chew gum at the same time to administer both first doses and second doses.
Thank you, Premier. And now, operator, can you please put through our final caller of the day?
Final question is Vincent McDermott. Go ahead, Vincent.
Hello, there's a question I imagine both of you would like to comment on. If it's possible we could see pockets of Alberta with vaccine rates below provincial benchmarks, how will the health system prepare for any potential community outbreaks, especially since we've already seen rural health centers overwhelmed during this current wave?
Dr. Hinshaw?
Oh, sorry. I was just waiting for the camera to pivot.
Okay.
Thank you for the question. And it is important. We obviously will continue to monitor the impact of COVID-19 and differential uptake of vaccines in different areas of the province. As I mentioned earlier, as we've been looking at the overall community level of protection, we have been looking at the proportion of Albertans who have some level of protection from post-infection immunity. And so as we look at the impacts that COVID-19 will have in the future following the reopenings and how that will impact rural communities, again, there's that mix of where individuals have some level of protection. They can certainly boost it by receiving a vaccine and have more durable and longer lasting protection. There's some good recent evidence that suggests that if somebody's had COVID-19 infection and then they have a dose of COVID-19 vaccine, that combination provides extremely robust protection, particularly when it comes to variants of concern. So again, while I would strongly encourage everyone to receive COVID-19 vaccine, we also need to take into account that combination. And as we're watching any particular spread, if we see pockets of concern, when we respond to outbreaks in a localized way of any kind of infectious disease, if there's a localized outbreak that's causing localized impact, we obviously will continue to have tools to be able to mitigate risks in a particular area if we are seeing that health system impact. But what's really important about this plan is that it focuses on the high level of protection across the entire province and then allows us to move away from a provincial level approach. And if we do need to utilize public health measures in a very localized area, of course, that's something in a targeted way. So I'm not saying we would be closing businesses in a particular town, but we could potentially be looking at, for example, employing quarantine measures or other measures with respect to outbreak management that we wouldn't need to employ across the province, but we may need to employ at a local level.
And I would say, just in addition, those are all absolutely on point remarks, of course, but Vincent, we have seen this happen in some other places. We've been following very closely the experience of jurisdictions ahead of us, ahead of the curve in terms of vaccines. One example would be the United Kingdom. They are contending with some outbreaks, localized outbreaks, largely in northeast British cities like Bradford, where they had lower vaccine uptake, particularly amongst younger people. So you can see that they're having to respond on a regionalized basis there to that challenge, and I think we can anticipate that that might happen from time to time here, which is why we'll continue with our investments in contact tracing and testing, and hopefully continued rollout of rapid test kits as well, all of which can help to equip local authorities to identify and contain local outbreaks if and when they happen.
And Vince, did you have a follow-up to wrap things up today?
Yeah, so I know the logistics of vaccinating isolated communities has been a factor in boosting vaccination rates in some rural parts of Alberta. So as more supply becomes available, how quickly could we see rural walk-in clinics like what we saw with the flu shot or in Fort McMurray last month, or even mobile clinics that have been seen in other jurisdictions?
We are, Alberta Health is developing a plan for exactly that kind of more responsive local rollout to remove barriers, make it more practical and convenient for folks to get the jab, particularly in the areas with low vaccine uptake. Dr. Hinshaw just mentioned that we'll be piloting one of those ideas with the drive-through clinic in Northeast Calgary. But Doctor, would you like to comment further on this, because I know a lot of work has been done on more intensive vaccination programs in areas with low take-up?
Sure. We're looking at areas, again, that have lower rates than the provincial average, and then considering what particular barriers may be experienced in those areas. So the same approach isn't going to work for every area, and we're working with Alberta Health Services and other partners to be able to identify what some of those barriers might be and then what might be effective in those areas. With respect to walk-in clinics like we are able to offer with influenza, one of the things that's important to remember about our COVID-19 vaccines is that they come in multi-dose vials. And so Moderna comes in a vial that has 10 doses in it, and Pfizer has a vial that has 5 doses in it. And right now, each of those doses is worth its weight in gold or more. Each of them are life-saving doses. And so it's important, especially in rural areas with small amounts of population, where there may not be a huge number of people coming through in a particular day. Right now, we do need to focus on appointment-based. We're trying to lower the barriers as much as possible. And if at some point in the future we are able to have, for example, maybe single-dose vials or other opportunities to be able to give vaccine to 1 or 2 people without the concern about wasting doses, that would make those kinds of clinics much more easy to do. So we are looking at the option perhaps of walk-in in places with higher populations, maybe piloting them in areas where we could potentially anticipate more demand. But we need to be really careful that we're not setting up opportunities for vaccine wastage, while at the same time we give Albertans every opportunity and remove every barrier possible to them being able to access protection for themselves and those around them.
Okay, thank you, Dr. Hinshaw. That concludes today's media event. Thank you.